Walking in, it was just a pleasure. I was greeted at the front and basically told exactly what was going to happen.
The moment I walked into his office, probably the moment that I called there, I felt like I was at home.
Dr. Barr's office made me feel very comfortable and at home.
Our office is like a family.
People were interested in me, in my needs, in the person that I am.
From the beginning to end, our patients feel heard, taken care of, and special.
Everyone just kind of explained to me what was happening.
I could call there and ask a million questions.
On a Friday night, I'll get a phone call from a patient asking just a simple question. I'm happy to take that phone call.
Being Dr. Barr's nurse for 8 years, I have seen amazing procedures and enjoyed amazing patients. Both at PGA National and our office in West Palm Beach, I have seen great results with patients.
I was a patient counselor for eye surgeons, and I asked them where to go, who was the best plastic surgeon. They sent me to visit with Dr. Barr.
I'm a laser technician or a laser specialist.
That was about 20 years ago.
I also do some hair removal.
I actually had a breast reconstruction, as well as a mini facelift, mini eye lift, and mini brow lift.
We target fine lines, crepiness, acne scarring, large pores.
About 10 years ago, I decided I love Dr. Barr's work. I believe in Dr. Barr. I love the office. I want to work for Dr. Barr. So now I'm his patient counselor. Having been a patient of Dr. Barr's previously, I am really able to relate to the patient's needs.
We have a beautiful office located downtown West Palm Beach on the Intercoastal.
Dr. Barr and our team also see patients at the PGA Resort and Spa in Palm Beach Gardens, Florida. The spa is magnificent. It gives the patients a more relaxed, laid-back feel. You're able to enjoy the waters of the world, the steam, the sauna, and also see Dr. Barr all in the same visit.
He is very calming.
He really hears the patient, listens to the patient, and achieves what the patient is looking for.
My job, our team, my team, is to work with these people and to say, look, here's what you're bringing with you. This is what we have to offer. And let's work together to come up with a plan that works for the both of us.
He looked at it from all sides. He explained to me different procedures and what he thought was best.
It really is about achieving expectations. You know, everybody comes in with a different face, a different body, a different story, a whole history with them.
He wants to meet the needs of the patient.
He enhances the true beauty that's inside of you.
What I'm doing most of the time when I'm listening, I'm hearing what their needs are. I'm listening to how someone is expressing how they feel, what their desires are. And with that, I have to put together the plan that's going to work for them based on what my skills will provide, based on what their expectations are about. And together we work as a team to put something that's going to make them feel and look great.
I did the mini lipo procedure. I had love handles that just would not go away no matter what I did.
I kind of thought that I looked kind of tired and a little haggard.
My mini liposuction was to target the troublesome areas that are hard and difficult to get with exercise.
This year I've had a mini facelift and also a brow lift.
We see patients in their 20s to patients, believe it or not, in their 90s.
I think that at my age, the thing that I fear most is having a procedure where I am put to sleep. So that had to be the best part for me.
We have options of doing these mini procedures under local anesthesia only. Patients can come in, they can have the work done, they're comfortable.
In just a couple of hours, I was in and out and back to work pain-free and seeing the results pretty quickly.
I felt nothing during the procedure or even after the procedure.
The best part of it was that there was really no downtime.
The area basically that I got taken care of was numb and I really didn't feel anything. I was awake the whole time. I was talking to the nurse. She was explaining what was happening. Dr. Barr kept asking me how I was doing and honestly I was doing great. It was just so easy to do.
For me it was easier than going to a dentist.
The nice thing is, because we've avoided the general anesthetic, we've avoided the hospital outpatient environment, we've avoided all those other criteria and made this a very sculpted, very personal, a very comfortable experience in the office with simply a local anesthetic, a pill if somebody wants to be a little bit more comfortable. That's it. We've reduced the risk, we increased the value, and we really have a wonderful result to present to people. When I first started, I came to town, I was really gung-ho with reconstructive procedures.
I was training for Ironman Florida. When I got hit by a car, I went through a windshield. Instantly, I had blood coming out of my face. I grabbed my phone out of my back pocket and called Dr. Barr. He's worked on my family before. I called him before I called 911. He told me, come right in.
We had some wonderful cases along the way. In particular, as a young boy who was an athlete, his finger got detached. We did a whole program on that.
So I had a nice ambulance ride. I let them do everything except stitch my face up because I wanted a plastic surgeon working on me. This is where I hit the windshield right here. I was torn wide open. He worked hours on my face, layer by layer. No one can believe how wonderful my face has turned out.
All the creative aspects of the reconstructive put into cosmetic focus, and that's where we're at today.
Luca RX has been a lifesaver for me. I can put it on post-injection. It will cover any kind of bruising I have. It's really changed how I get injections. Before I used to have to hide out for the weekend if I had any bruising. Now I can go out right away due to its ability to camouflage. It is convenient and easy to purchase at Dr. Barr's office. Luca Cosmetics is something you can use all the time and makes your skin look great. Not only post-surgical or post-injection, but everyday use.
I want to be able to give our patients the best care possible.
One of the first things I do when I wake up in the morning is look in the mirror. I look alive, I feel alive, and I can't wait to start the day. It's a wonderful feeling.
The most fulfilling part of what I do is seeing people be happy. When I hear somebody say, wow, I know we hit it out of the park, and for that individual, for me, the experience is, it was all worth it.